Well, earlier in the week, the Canadian government banned travelers from Nigeria and 9 other African countries over concerns about the spread of the Omicron COVID-19 variant. Canada expanded the travel ban to Egypt, Nigeria, and Malawi after an initial ban imposed only for countries in southern Africa. On Sunday, Canada detected its first case or cases of the Omicron variant in individuals who had recently traveled to Nigeria. The Canadian government announced additional border measures to reduce the risk of the importation and transmission of COVID-19 and its variants in Canada related to international travel.
Dont nous avons parlé. Premièrement, nous ajoutons 3 pays à la liste des 7 pays.
First, we will be adding 3 countries to the list of 7 countries we currently have that we spoke about last Friday. These countries are Egypt, Malawi, and Nigeria. As a reminder, foreign nationals from all of these countries, and now from these 10 countries, these foreign nationals who've been to those countries will not be able to enter Canada if they have been to those countries over the past 2 weeks. Also, Canadians and permanent residents, as well as all of those with the right to return to Canada who have transited through these 10 countries over the past 2 weeks, well, when they return to Canada quarantine, they will have to be tested at the airport and wait for their results before exiting quarantine. That is for Canadians and permanent residents who are vaccinated. For those who are unvaccinated, will follow the current measures.
And to discuss the new COVID-19 variant and, of course, why Canada is banning travel from other countries, we're joined from Canada by Dr. Francis Okolie, a family physician and clinical lecturer at the University of Alberta. Hello, Doctor, and thanks for joining us on Newsnight. Tell us, how escalating is the Omicron variant in Canada, particularly at this time of the year?
Oh, thank you for having me today. Like you know, the virus the Omicron variant is a new thing, and we're still trying to get around what exactly the virus is made up of. At the moment, things are not too bad here with regards to the spread of the Omicron virus, and but it's a bit too early to say. In this province, for instance, we've got just about 4 cases recorded, and in a large province like Ontario, I think the amount of patients who have been detected as having the virus are quite negligible. So it's not escalated in that sense.
Would you say that the Canadian government is acting on panic measures? Because if you look at the Omicron variant, Netherlands, the Dutch government said it originated some 3-4 days even before the South Africans who were proactive in announcing their own, discovery of that variant. And well, scientists or clinical investigations have not been so conclusive as to talk about how dangerous this variant is, have they?
Yes, it's quite interesting you said that, and it's true. It's early to say. There's nothing yet to suggest that this variant is more virulent than any other variant we've encountered so far. And in fact, in South Africa, where the variant has been isolated or was apparently first isolated, cases are rising, but the cases are not even as high as they were at the peak of June, July last year. So I think the Canadian government is actually acting on the side of caution. This is probably a measure on the abundance of caution, really. And the thinking really is it's better to be prepared for the worst. And if at the end of the day, after investigations and more research, we find that the Omicron virus is not as virulent or as potent as we think, then measures would be relaxed. So the government is acting, and most of the European governments are actually acting based on caution more than anything else. It's but I think it's a bit I think it's a bit excessive personally, but these are global health measures that they think is best for the country. Yeah.
Yes, Dr. Francis, it is quite excessive that the positions of the presidents of Nigeria and South Africa, and but another main issue is that Nigerian government has agreed or has introduced booster shots from the 10th of December to those who have been vaccinated twice with AstraZeneca or Moderna and J&J ones, but with 6 months, after the two doses may have been completed. Some critics are saying that the vaccines are not really efficacious. That's why you're having booster shots, you're having them being developed into capsules. Is there any scientific evidence to support that?
Well, I think if we look at the facts on ground, and that would be if we have to consider the mortality and morbidity with regards to the cases related to the COVID virus. Since the introduction of the vaccines, there has been a drastic drop in morbidity and mortality rates. So I think it's more than clear that the vaccines are really doing something. Now, the argument for the booster shots is based on research. We have found, or the scientists have actually found that the efficacy of the vaccine could drop after a few months, hence the booster dose. So if we basically look at the facts on ground, the rates of admissions into the critical care units, the rates of hospital admissions have dropped drastically since the introduction of the vaccine. I mean, if you take a country like Canada, for instance, where you have about 78% of the population vaccinated, things are not back to normal, but the measures have been quite relaxed until the emergence of the Omicron variant. So I don't think it's wise. I don't think it's logical to say that you don't really need to have the vaccine because the vaccine would wear off in its efficacy anyway, because the facts on ground and the figures we see do not suggest that.
Yeah, great there. How are Nigerians like you in the diaspora helping to support, those of us back home, Nigerians back home and the rest, in this battle against, the rampaging COVID and the new variant, just like you said, of course, is yet to, be seen as dangerous or more dangerous than the first two variants that we had?
I mean, well, all we can do from here to help our fellow Nigerians is basically to educate people back home. But I think I find that challenging. The truth is that it appears that because the mortality rate in Africa and in Nigeria in particular is not really high. A lot of Nigerians still think that that there's no big deal to this virus. So a lot of Nigerians I speak to don't really think they need to take the vaccines. A lot of Nigerians I speak to don't really think there is a virus. And those who think that, okay, there is the COVID virus, feel that it's not too different from any other flu virus. So I think the problem we encounter with our fellow brothers and sisters back home is trying to educate them that they need to take this virus seriously. They need to wear their masks. They need to social distance. They need to, they need to put all those guidelines that we've been talking about into practice.
All right, thanks very much. No better place for you to have dropped the anchor there. That advice is very timely because a lot of Nigerians, or some Nigerians, let me not say a lot because there's not been any statistical data to say they don't want to take the jab or they are averse to taking it and the rest. That was Dr. Francis Okolie, clinical lecturer and doctor in family medicine from the University of Alberta in Canada. Thanks for joining us.